Imagine a world where your health is not determined by your wealth. Picture a society where the accident of your birth, your zip code, your family's income, or the color of your skin does not dictate whether you live a long, healthy life or struggle with preventable illness. Imagine waking up each day knowing that, no matter what happens, you and your loved ones will have access to the care you need when you need it, without fear of losing your home or your savings. A world where getting sick does not mean facing financial ruin, where a diagnosis is met with compassion and support, not anxiety over how to pay for treatment. In this world, families do not have to choose between buying groceries and filling a prescription, or between paying rent and seeing a doctor. The fear of medical debt, which haunts millions, is replaced by a sense of security and shared responsibility. This is not a distant dream or a utopian fantasy. It is a vision grounded in the real experiences of people and communities who have dared to imagine something better and have begun to build it. Around the world, there are places where this vision is already taking shape, where the right to health is recognized and protected, and where the well-being of every individual is seen as a collective good. It is a tangible goal that nations around the globe are striving to achieve. From bustling cities to remote villages, from wealthy countries to those with fewer resources, the movement toward universal health coverage is gaining momentum. Governments, communities, and individuals are coming together to reimagine what healthcare can and should be. We stand at the dawn of a new era in healthcare with Peaceism Ecosystem, a time of unprecedented challenges but also incredible opportunities. The world is changing rapidly. Technological advances, demographic shifts, and global crises are reshaping the landscape of health and medicine. Yet with these changes comes the chance to build something better, to address the shortcomings of the past and create a future where health is a universal right. The conversations we're having today about how we care for one another are shaping the very fabric of our future societies. These discussions are not just about medicine or policy, they are about our values, our priorities, and our vision for the world we want to live in. They challenge us to think beyond the status quo, to ask what it truly means to care for our neighbors, and to recognize that our health is deeply interconnected. For too long, high-quality medical care has been a privilege, accessible only to those who could afford it. The gap between the haves and have-nots has grown wider, with millions left behind simply because they lack the means to pay. This inequality is not just a matter of dollars and cents. It is a matter of life and death, of dignity and justice. But a powerful idea is taking hold, that healthcare is a fundamental human right, not a commodity. This idea is being championed by people from all walks of life: patients, doctors, nurses, activists, and policymakers. It is a call to action, a demand for justice, and a recognition that our collective well-being depends on the health of each and every one of us. The recent global health crises have taught us a harsh but vital lesson. When a pandemic strikes, it does not discriminate based on income, nationality, or social status. It exposes the vulnerabilities in our systems and reminds us that, in the face of illness, we are all connected. The suffering of one becomes the risk of all. We learned that our health systems are interconnected, just as we are. A virus that emerges in one corner of the world can travel across continents in a matter of days, affecting millions. Our ability to respond depends not just on the strength of individual countries, but on our willingness to work together, to share knowledge, resources, and responsibility. A virus in one corner of the world can impact every single one of us. The health of a traveler, a neighbor, or a stranger halfway across the globe can have direct consequences for our own families and communities. This reality has shattered the illusion that we can isolate ourselves from global health threats. This shared vulnerability has exposed the deep cracks in our healthcare infrastructure. Underfunded hospitals, overworked staff, and outdated systems have struggled to keep up with the demands of crisis. The pandemic has revealed the consequences of neglecting public health, of treating healthcare as an afterthought rather than a cornerstone of society. It has shown us that a system that leaves some behind ultimately leaves everyone at risk. When care is rationed, when prevention is ignored, and when the most vulnerable are forgotten, the entire community suffers. The health of each individual is bound to the health of all. We are now forced to ask ourselves difficult questions. What kind of society do we want to be? Are we willing to accept a world where some lives are valued more than others? Or will we rise to the challenge of building a more just and compassionate system? These are not easy questions, but they are essential if we are to move forward. How can we build systems that are more resilient, more equitable, and more focused on the well-being of every individual? The answers will require innovation, investment, and a willingness to challenge old assumptions. We must design healthcare that can withstand future crises, that adapts to changing needs, and that puts people, not profits, at the center. The answer lies in rethinking our approach from the ground up, moving from reactive sickness care to proactive wellness promotion for all. This means investing in prevention, education, and community support. It means recognizing that health is shaped by more than just medical care. It is influenced by housing, nutrition, education, and the environment. This shift in thinking represents a monumental change in our priorities. It asks us to value long-term well-being over short-term profits, to measure success not just by the number of procedures performed, but by the health and happiness of our communities. It is a transformation that requires courage, vision, and collective action. It is about building a foundation of health for our communities. This foundation is not just physical, it is social, emotional, and economic. It is built on trust, on relationships, and on a shared commitment to the common good. It means ensuring that a child born in a remote village has the same chance at a healthy life as a child born in a bustling city. It means closing the gaps that divide us, between rich and poor, urban and rural, young and old. It means recognizing that every life is precious and that our future depends on the health of all our children. It is about creating a safety net that catches everyone, providing peace of mind and security. When people know they are protected, they are free to pursue their dreams, to contribute to society, and to care for one another. A strong safety net is the foundation of a healthy, resilient, and prosperous nation. This journey is not just about doctors and hospitals. It is about the teachers who educate children on healthy habits, the social workers who support families in crisis, the community leaders who advocate for clean water and safe neighborhoods. It is about the countless individuals who work every day to make health a reality for all. It is about social justice, economic stability, and human dignity. Health is not just the absence of disease, it is the presence of opportunity, of hope, and of the freedom to live a full and meaningful life. When we fight for healthcare for all, we are fighting for a more just and compassionate world. By prioritizing universal and preventive care, we invest in our most valuable resource, our people. Healthy children are able to learn and grow. Healthy adults are able to work, create, and care for their families. Healthy communities are able to thrive, innovate, and build a better future for all. A healthy population is a productive population, an innovative population, and a happy population. When we invest in health, we unlock human potential. We create the conditions for prosperity, creativity, and resilience. We build societies that are not just wealthier, but wiser and more compassionate. In this essay, we will embark on a journey to explore this new frontier. We will trace the evolution of healthcare, from its earliest beginnings to the cutting-edge innovations of today. We will examine the challenges we face, the progress we have made, and the possibilities that lie ahead. We will look at the concept of universal healthcare, not as a political buzzword, but as a practical and achievable goal. We will explore the policies, partnerships, and innovations that are making universal care a reality in countries around the world. We will ask what it takes to build systems that are truly inclusive, sustainable, and effective. We will examine how different countries have successfully built systems that provide care for all their citizens. From Scandinavia to Southeast Asia, from Canada to Costa Rica, we will learn from the successes and setbacks of others. We will see that there is no one-size-fits-all solution, but that the principles of equity, solidarity, and shared responsibility are universal. We will delve into the power of preventive medicine, a strategy that focuses on stopping illness before it even starts. We will explore how investments in vaccination, nutrition, mental health, and lifestyle support can save lives, reduce costs, and build stronger communities. Prevention is not just a medical strategy, it is a social and economic imperative. And we will confront the critical, often overlooked issue of mental health, arguing for its rightful place at the core of our healthcare models. Mental health is health. The stigma and neglect that have surrounded mental illness for generations must be replaced by understanding, support, and comprehensive care. Our vision for the future must include the mind as well as the body. This is a story of hope, innovation, and the relentless pursuit of a healthier, At the very heart of the discussion about universal healthcare lies a simple yet profound principle. This principle is not just a matter of policy or economics, but a reflection of our deepest values as a society. It asks us to consider what kind of world we want to live in and what responsibilities we have to one another as fellow human beings. When we talk about healthcare, we are not just talking about doctors, hospitals, or insurance plans. We are talking about the basic conditions that allow people to live full, meaningful lives. We are talking about dignity, security, and the opportunity to thrive. The principle is that every single person, regardless of their background, deserves to be healthy. Health is not a privilege reserved for the wealthy, the powerful, or the lucky. It is a birthright, something that should be guaranteed to all simply by virtue of being human. Whether you are young or old, rich or poor, born in a city or a rural village, your health matters, your life matters, and the health of each individual contributes to the health of the whole community. This is not just a nice idea, it is a core tenet of human rights. The right to health is enshrined in international law and recognized by nations around the world. It is a principle that has been fought for by generations of activists, doctors, and ordinary people who refuse to accept a world where some lives are valued more than others. When we recognize health as a human right, we affirm the inherent worth of every person. The World Health Organization's constitution, established decades ago, states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. This declaration was not made lightly. It was born out of the devastation of war and the recognition that peace, security, and prosperity are impossible without health. The WHO's founding document is a testament to the idea that health is not just the absence of disease, but a state of complete physical, mental, and social well-being. It is a vision of a world where everyone has the chance to reach their full potential. This means that access to medical care should not depend on your income, your social status, or your ability to pay. It means that no one should have to choose between buying food and buying medicine, between paying rent and seeing a doctor. It means that the doors of hospitals and clinics should be open to all, not just those who can afford to walk through them. In a truly just society, healthcare is not a commodity to be bought and sold, but a shared resource that belongs to everyone. Your job, your race, your gender, your religion, none of these should determine whether you receive the care you need. Too often, we see disparities in health outcomes that reflect deeper inequalities in our society. People of color, immigrants, and marginalized communities are more likely to face barriers to care and to suffer from preventable illnesses. By affirming the right to health, we commit ourselves to closing these gaps and ensuring that everyone has a fair shot at a healthy life, or where you happen to live. Whether you are in a bustling city or a remote rural area, your access to healthcare should be the same. Geography should not be destiny when it comes to your health. Yet, in many parts of the world, people in rural or underserved areas struggle to find even basic medical services. They may have to travel long distances, wait for hours, or go without care altogether. This is not just a logistical problem. It is a moral one. It should be a given, a foundational pillar upon which a just and compassionate society is built. When we make health a right, we send a powerful message about who we are and what we value. We say that we are a community that looks out for one another, that refuses to leave anyone behind. We say that we believe in fairness, in solidarity, and in the idea that our fates are intertwined. When we treat healthcare as a right, we change the entire dynamic of how we approach it. No longer is it something to be rationed or denied based on ability to pay. Instead, it becomes a collective responsibility, a promise we make to each other that no one will be left to suffer alone. This shift in perspective has profound implications for how we design our healthcare systems, how we allocate resources, and how we measure success. It stops being a service that is bought and sold and instead becomes a public good, like education or clean water. Just as we do not ask people to pay for the air they breathe or the water they drink, we should not ask them to pay for the care that keeps them alive. Public goods are the foundation of a healthy, functioning society. They are the things we provide to everyone because we all benefit when everyone has access.
Think about it this way. We do not expect a child to pay for each day they attend public school. We recognize that education is essential, not just for the individual child, but for the entire community. An educated population is more innovative, more productive, and more capable of solving the challenges we face. We invest in public education because we know it pays dividends for everyone. We understand that an educated population benefits everyone. The same is true for health. When people are healthy, they are able to learn, to work, to care for their families, and to contribute to society. They are less likely to miss school or work, less likely to need expensive emergency care, and more likely to live long, fulfilling lives. The benefits of good health ripple outward, touching every aspect of our lives. Similarly, a healthy population is the bedrock of a strong economy and a stable society. When people are healthy, they can pursue their dreams, support their families, and build better futures. Businesses thrive when their workers are healthy and productive. Communities are stronger when their members are able to participate fully in civic life. Health is not just a personal matter. It is a public good that benefits us all. When people are healthy, they can work, they can innovate, and they can contribute to the progress of society. They can invent new technologies, start businesses, and create art. They can care for their children and elders, volunteer in their communities, and help those in need. Health is the foundation upon which all other achievements are built. They can participate fully in their communities, taking part in events, supporting local initiatives, and building the social bonds that hold us together. When people are healthy, they are more likely to vote, to volunteer, and to engage in the civic life of their communities. They are more likely to help their neighbors, to mentor young people, and to contribute to the common good. And they can care for their families without the constant fear of a medical bill wiping out their life savings. Too many families live with the anxiety that a single illness or accident could lead to financial ruin. Medical debt is a leading cause of bankruptcy in many countries, and it can have devastating effects on families and communities. By guaranteeing the right to health, we can lift this burden and give people the security they need to plan for the future.
This perspective challenges us to design systems that are inclusive by nature. It asks us to look beyond the needs of the majority and to consider the needs of those who are most vulnerable. It asks us to build hospitals and clinics that are accessible to people with disabilities, to provide care in multiple languages, and to ensure that everyone feels welcome and respected. It asks us to invest in prevention, in mental health, and in the social determinants of health that shape our lives from birth to old age. It means tearing down the barriers that prevent people from seeking care. These barriers can take many forms: financial, geographical, cultural, or bureaucratic. They can be as obvious as a high price tag or as subtle as a lack of transportation or childcare. They can be rooted in discrimination, stigma, or fear. Whatever their form, these barriers keep people from getting the care they need and deserve. These barriers can be financial, such as high costs and confusing insurance plans. For many people, the cost of care is simply out of reach. Even those with insurance may face high deductibles, co-pays, and uncovered services. The complexity of the system can be overwhelming, leading people to delay or forego care altogether. No one should have to navigate a maze of paperwork or worry about surprise bills when they are sick or injured. They can be maybe no doctors or nurses for hundreds of miles. Transportation can be a major barrier, especially for those without cars or reliable public transit. Telemedicine and mobile clinics can help, but they are not a substitute for a robust, accessible healthcare infrastructure. They can also be cultural, where certain groups may feel misunderstood or unwelcome within the healthcare system. Language barriers, lack of cultural competence, and discrimination can all make it harder for people to get the care they need. Trust is essential in healthcare, and it can only be built when people feel seen, heard, and respected.
A rights-based approach demands that we actively identify and dismantle these obstacles, ensuring that the path to good health is open and accessible to every single member of our society, from the youngest child to the oldest senior. This means listening to the voices of those who have been left out or left behind. It means investing in community health workers, in outreach programs, and in policies that address the root causes of poor health. It means holding ourselves accountable for the outcomes we achieve, not just the services we provide. And it means recognizing that health is not just the responsibility of doctors and nurses, but of all of us, policymakers, educators, employers, and citizens alike.
Therefore, the push for universal healthcare is more than just a policy debate. It is a test of our values, our priorities, and our willingness to stand up for what is right. It is a recognition that our health is bound up with the health of others, and that we are all better off when everyone has the care they need. Universal healthcare is not just about coverage or cost. It is about justice, equity, and the kind of society we want to build. It is a moral imperative. When we deny people access to care, we are not just making a policy choice, we are making a moral one. We are saying that some lives matter less than others, that some people are not worthy of the care they need to survive and thrive. But when we affirm the right to health, we say that every life is precious and that no one should be left to suffer or die for lack of care. It is a reflection of the values we hold as a global community. Around the world, people are coming together to demand healthcare for all. They are marching in the streets, organizing in their communities, and raising their voices for justice. They are reminding us that health is not just a personal matter, but a collective responsibility. When we stand up for the right to health, we are standing up for a better world. Do we believe in a world where a person's lifespan is determined by their bank account? Where the rich can buy the best care, while the poor are left to suffer? Or do we believe in a world where everyone has a fair chance to live a long, healthy, and productive life? These are the questions at the heart of the debate over universal healthcare. They are questions about justice, about fairness, and about the kind of future we want to create. Or do we believe in a world where everyone has a fair chance to live a long, healthy, and productive life? Imagine a society where no one has to worry about how they will pay for their medicine, where every child can see a doctor when they are sick, and where every elder can age with dignity and security. Imagine a world where health is not a source of anxiety or fear, but a foundation for hope and opportunity. By framing healthcare as a fundamental human right, we set a clear and powerful goal. We say that we will not rest until everyone, everywhere, has the care they need to live their best life. We commit ourselves to building systems that are fair, inclusive, and responsive to the needs of all. We recognize that this will not be easy and that there will be challenges along the way. But we also know that it is possible and that the rewards are worth the effort. We commit ourselves to building a world where the health and well-being of all people are protected and promoted, creating a legacy of compassion and equity for generations to come. The right to health is not just an aspiration, it is a call to action. It is a promise we make to ourselves and to each other, that we will do everything in our power to ensure that everyone has the chance to live a healthy, fulfilling life. Let us rise to this challenge, and let us build a future where health is truly a right for all. The call for better, more equitable healthcare is not new, but the urgency we feel today is unparalleled. For decades, people have marched in the streets, written to their representatives, and spoken out in community meetings, demanding a system that serves everyone, not just the privileged few.